Good evening and thanks for staying tuned. Welcome to our COVID-19 update here on Channels Television. I am Ladi Akeredoluale. Here are the highlights at this hour. 265 Nigerian returnees from the United Arab Emirates arrived Lagos as federal government extends ban on flights by 4 weeks. Social distancing still a problem for Nigerian banks as ease of lockdown enters day 3. Channels Media Group supports government efforts aimed at ameliorating the plight of the vulnerable, hands over palliatives to the Lagos State government. And United Kingdom becomes the first country in Europe to exceed 30,000 deaths from COVID-19 infections. The Presidential Task Force on COVID-19 says that the ban on flights coming into and leaving Nigeria has been extended for another 4 weeks. This was confirmed by the chairman of the Presidential Task Force, Mr. Boss Mustafa, at the PTF media briefing in Abuja. He appealed to state governors to align their guidelines with those of the federal government, particularly as it concerns the deportation of Almajiris as it violates the ban on interstate travel.
Tomorrow marks the last day for the enforcement of the closure of Nigeria's airspace to flights. We have assessed the situation in the aviation industry and have come to the conclusion that given the facts available to us and based on the evidence of experts, the ban on all flights will be extended for an additional 4 weeks. We have continued to interface with the governors, and I'm pleased to inform you that the Nigerian Center for Disease Control will be visiting the Kogi and Cross River states to provide support to the state EOCs. This is a giant leap in the dialogue and collaboration process. We are also retooling all federal medical institutions as part of the overall support to the states.
Also at the briefing, the Minister of Health, Dr. Osagie Ehanire, emphasized the need to heed the advisories, otherwise more people will be exposed to the risks. He added that the This Day Dome in Abuja, which has been converted to a 300-bed capacity isolation center with a 10-bed space ICU, will be commissioned next week.
The reported cases of infection in Kano are a case in point, showing the urgent need for intensifying training, particularly among healthcare workers. It is clear that many doctors and nurses who are not familiar with the protocol for the infections of this caliber will benefit from the training. Community mobilizers have been deployed at the grassroots to continue to sensitize our people through the National Primary Healthcare Development Agency. We are encouraging and supporting states to increase the number of isolation centers nationwide and also the quality of the isolation centers. And we're extremely grateful to corporate organizations and philanthropists who have donated isolation facilities, diagnostic equipment, commodities, and sundry supplies relevant to our response effort to COVID-19 threat.
Still speaking on aviation, the Minister of Aviation, Hadi Sirika, says the aviation industry is worst hit by the COVID-19 pandemic and it pushed the losses at 17 billion naira plus per month. Mr. Sirika explains that more measures need to be put in place for the aviation sector to be operational.
We are worse hit than any other sector. Some 17 billion monthly is being lost by the airlines thanks to COVID-19. The sector is highly regulated and very coordinated and has set standards that must be followed at all times, regardless, because they speak to safety. So safety, security, and efficiency of the sector is extremely important regardless of what is going on. We would not be able to just open up after closing for several weeks and perhaps for some months, to open up and start businesses as usual. There are safety issues concerned. Those airplanes have been kept. When we are going to bring them back into service, we will ensure that they are airworthy and that they can make those flights and safely.
Meanwhile, a chartered plane conveying 265 returnees from the United Arab Emirates has arrived at the Murtala Mohammed International Airport in Lagos. The aircraft touched down at about 7:40 p.m. today. The flight was originally scheduled to arrive at about 3 p.m. but suffered a slight delay. It had to make a U-turn to base after a pregnant woman was delivered of a baby on board and with some complications. The chairman of the Nigerians in Diaspora Commission, Abike Dabiri Erewa, confirmed to Channels Television that the plane had to return to Dubai so the woman could get medical attention. Guidelines set by the federal government to curb the spread of COVID-19 are suffering setbacks as many residents, particularly in the nation's commercial capital, Lagos, engage in their daily routines, flouting the rules set by the government. Channels Television visited banks, bus stops, and other public places on day 3 of the ease of the lockdown in Lagos, where residents are going about their businesses without observing physical distancing and other precautionary measures. Many bank customers were seen gathering around different bank premises wearing face masks but with little or no effort to avoid physical contact.
The pre-lockdown life is returning with the notorious Lagos traffic. The number of confirmed COVID-19 cases has grown since the index case was confirmed in February.
We again recognize our frontline.
Now, more efforts are ongoing to avoid a worst-case scenario, which is a surge in fatalities. It's a long list of guidelines set by the government. Mandatory use of masks and social distancing are the basics. From passengers waiting at different bus stops to those who already struggle to find their way into a bus, 2 meters apart is a luxury hard to come by in Lagos.
The number of vehicles we have are quite few, and because the vehicles are few, it's not enough for all the people to go around. So asking 2 persons to stay on the seat of the bus is not possible. That is why you see most of the buses still crowded.
All schools remain closed till further evaluation, and these children have got more times on their hands. They choose to play some sports. Controlled access to markets and locations of economic activities, the compliance to this guideline is very low as well. Trading at this market goes on like any other day.
We do jingles on radio, on television, and then we have motorized campaigns. All of this we are going to step up. Day before yesterday, the governor met with traditional rulers. He met with local government chairmen. He met with market leaders. He has had meetings with drivers' unions members and their leaders. And I suspect that if we continue this kind of engagement and the conversation grows better than it is now, things will change.
The chaotic scene at the bank started since Monday. Bank officials are observing physical distance in the banking hall, but crowd control remains a problem.
The thing is, I'll be here around after 9. But the issue that I will collect number here to enter. So as they call the numbers, people will be entering. And we understand that maximum is 100,000 withdrawal.
The manager are trying to maintain the protocol, but the way people are so anxious is as if there's nothing he can do in respect to that, because he said that only 5 people are allowed to go in. Nigeria is not out of the woods yet, and stricter measures are announced to keep the numbers down.
but with the continued breach of the guidelines, the task may even be more difficult. Dari Ido, Channels Television News.
The Lagos State government is taking delivery of food items donated by the Channels Media Group as its contribution to support efforts aimed at cushioning the effect of the coronavirus disease on the poor and vulnerable residents. The food items donated include 100 bags of 50 kilograms of rice, 300 bags of 25 kilograms of rice, 250 cartons of noodles, 250 cartons of spaghetti, and 75 cartons of vegetable oil. The Permanent Secretary in the Ministry of Information, Mr. Olushina Thorpe, who received the gifts on behalf of the state government, commended the philanthropic gesture of the news broadcast organization. He assured the management of the Channels Media Group of judicious distribution of the items to the target population.
Top management staff of Channels Television Media Group arrived at the warehouse in Ogba, used by the Lagos State government for storing of food items procured or donated as relief items for COVID-19. The team comes with a truckload of various food items comprising rice and noodles, spaghetti and vegetable oil, each in large quantity.
We believe that there should be a concerted effort, not only by individuals but corporate organizations, to support what Lagos State government is doing. And so Channels Television is keen into this vision, and we'd like to use this opportunity to extend our congratulations to the Lagos State government and the governor for the able way he has led in fighting against the COVID-19. And this is our gift from Channels Media Group to Lagos State government and to the people.
The Permanent Secretary in the Ministry of Information and Strategy is delighted at the philanthropic gesture of the broadcast organization. He explains how the items will enhance the state government's effort at reaching those in need.
Since this palliative started, the Lagos State government has been able to touch the lives of about 500 households. 500,000 households. So we still need more because we need to reach out more to members of the public. So let me appreciate the Channels Media Group and extend the felicitation of the Lagos State government to the chairman. He's a senior colleague who is known for all those good things. So be rest assured that Lagos State government will do justice to this.
With over 22 million people in population, Lagos certainly accommodates a large populace of the poor and vulnerable. However, with support from individuals and corporate organizations like Channels Media Group, the state government says it hopes to reach more vulnerable households with food and other palliative items.
In Kano State, 3 COVID-19 patients have been discharged from its isolation center with 8 deaths recorded. Meanwhile, more health workers in the state have tested positive for the coronavirus while attending to patients at the National Orthopedic Hospital, Dala, as well as the Aminu Kano Teaching Hospital in Kano. The chairman of the National Orthopedic Hospitals branch of the Association of Resident Doctors told Channels Television that the affected health personnel were 3 consultant doctors, 9 resident doctors, and 3 nurses who treated an asymptomatic COVID-19 patient. Also, 12 of the new cases are health workers at the Aminu Kano Teaching Hospital, as confirmed by the Kano branch of the Nigerian Medical Association, as well as the state COVID-19 task force. There's been a sharp increase in confirmed COVID-19 cases in Kano, overtaking the Federal Capital Territory to record the second highest number of cases in the country. In Abuja, it's day 3 of the ease of the lockdown, and compliance to personal responsibility laws are on the rise in parts of the nation's capital. Banks are more conscious of social distancing for customers waiting their turn to enter the banking halls. Transport unions have instructed their members to observe social distancing as they load passengers or face penalties. However, passengers are being asked to pay for the empty seats. Our correspondent Kayla Megwa reports.
It's 6:45 p.m. and this otherwise busy Mabushi Road is virtually empty. The Abuja city center is cleared out, probably because a lot of the traffic usually found here is from residents who live in the suburbs, and we see them here making the dash home before the curfew begins. Earlier, as seen in the past few days, law enforcement is on ground to ensure social distancing in commercial transport vehicles. And unions have educated their members on the new loading laws.
We were instructed, basically by our union, to strictly adhere to the rules of the putting the face masks, and to make sure anybody you are carrying along the road or around within Abuja, you make sure the passenger is putting on face masks too. 2 passengers behind and 1 at the front.
Unlike the rowdy bank entrances of the days before, social distancing is being enforced.
It's in line with government directives to maintain physical distance, 2, in order to enter as we have to enter 4.
We screen them from the gate. We use a thermometer to check the temperature and sanitize their hands. And when they reach the banking hall, there's automatic sanitizer for everybody. Before transaction is sanitized, and after transaction is sanitized before you step out of the bank.
The FCT Task Force on COVID-19 had earlier stated that keeping Nigerians COVID-19 free during this relaxed lockdown would largely depend on adherence to personal responsibility by Nigerians.
We'll be going around to check all of these compliance. We'll be checking vehicles, checking how many passengers are inside, how many passengers are in tricycles for the areas that work in the suburbs here. It's one big enforcement operation that we'll be carrying out here. It will be very tasking for us here, but I'm sure we'll do it while also appealing to residents to please understand that this is not just a government policy by some big men on top, but a guide that we all stay alive.
The compliance to personal responsibility by residents of the nation's capital will be examined in the next few days to determine if the eased lockdown will be extended or cancelled. Kayla Nagwa, Channels Television News.
Kayla is in our Abuja studios now and joins us at this time. Kayla, this time around, some more positive news, it appears, some more compliance to the guidelines.
Absolutely, Laddie. It was very refreshing to see all of that going on today. And we purposely went back to the places that we had been at before. So we went back to the same banks where we saw rowdiness a few days ago. And we see that they're trying to enforce social distancing outside of the banks, before they come into the banking halls. And then, of course, we're seeing a lot of people wearing face masks now, more conscious of it. So it was interesting to see all of that in the city center. But I do have to know that this is the city center. We'll be doing the suburbs in a few days' time to see how compliance has become better or worse in those places. But compliance is a lot better. We can see. And another thing that, another reason why many people were probably not in the city center in the evening is because, Ramadan is on. So a lot of people have probably gone home to break their fast. Many people are conscious of the lockdown as well, conscious of the curfew, which starts at 8 p.m. So a lot of them go home early. So we're seeing that happening. And it's refreshing to see, Laddie.
When we talk about the curfew, which you just mentioned, it's creating a whole lot of difficulty in the nation's commercial capital with people racing home and then getting caught at checkpoints where they then, for large parts, have to spend a great deal of time trying to navigate their way. And we've had reports of people spending hours at those places. Is it a similar story in Abuja? What's the situation with that curfew?
It's a little different here. What I'm seeing when the curfew hits is that the law enforcement on the roads don't really know that essential services have to go to work at that time. So we're seeing a lot of doctors. I had to face it twice. You try to explain, no, I'm on essential services, I have to go to work. And they tell you, no, you just have to go back. They don't want to listen to what you have to say. And I'm wondering how much information the security agents in the nation's capital have about who is allowed to move around during the curfew. It's people who work in TV stations, in radio, hospitals, people who run shifts and things like that. So it's a little difficult, especially for journalists. And I was listening to the PTF briefing today, and I heard a lot of journalists complain about that when it's time for the curfew, everyone is asked to turn back, regardless of whether you're providing essential services or not. So that needs to be checked. I haven't, as you stated, seen a situation where, many people are now kept for hours. I hear that in some parts of the country, they have to actually spend the night there, because they wouldn't let them in. I'm not seeing that happening in the nation's capital right now. But when it comes to those who provide essential services during the curfew, we're seeing a lot of problems with that situation, Laddie.
Thank you very much, Kayla. It's refreshing to hear positive news out of the nation's capital tonight. Do continue to stay safe, and we'll be in touch with you. We'll take a break at this point. When we'll come back, we'll bring you up to date with the number of cases in the country, as well as its breakdown in terms of states, as well as the view from other parts of the world. Please stay on with us. Thanks for staying tuned. Welcome back to our COVID-19 update. The total number of confirmed COVID-19 cases in Nigeria continues to rise, totaling 2,950 at the moment. With 481 of the patients discharged and 98 deaths recorded, the number of active cases stands at 2,371. Now let's look at the numbers region by region. The Southwest tops the list with a total of 1,423 cases, and Lagos holds the highest in that region. The Northwest follows with a total of 719 cases, 397 of which come from Kano. The North Central has a total of 344 cases, with the FCT accounting for 307 of this. With 106 cases, Borno State takes a chunk of the total cases in the Northeast, which stand at 329. The South-South has 111 cases, with Edo State accounting for 65 of this total. The whole of the Southeast has a total of 18 cases, and Enugu tops the list, still at 8 of those cases. Joining me in our studio is a consultant public health physician, Dr. Esther Oluwole. Thank you so much for coming in at this time.
Thank you for.
We are having difficulties with getting people to comply with these regulations. I don't know whether it's linked or not, but we are also having rise in the number of confirmed cases. Are these the fears that many of your colleagues expressed when the whole issue of should we ease the lockdown or should we not was being, are we realizing those fears now, do you think? Is it?
Exactly. Especially because people thought the easing of the lockdown is everything is as usual, as it used to be, which is not supposed to be. So because of the way people rushed out and not adhere to the preventive measures, that's why we are seeing rising in cases. And if care is not taken, it's going to continue to rise, and we will not be able to flatten the curve. And I hope that we are not going to be, the government is not going to be talking of another new lockdown.
Which brings up the other issue of more health workers seeming to test positive.
Exactly.
We're having all kinds of reports about the numbers that are involved. Doctors, today there was the story from Kano, consultants, resident doctors, nurses, and other, all testing positive. Is this a problem of PPEs, which you and I have discussed before now, or is there something else happening?
Well, because COVID-19 is actually a new virus, nobody prepared for it. It wasn't really prepared for. So apart from the issue of PPE that are in short supply, the health workers need to be trained and retrained. Training cannot be enough for health workers. So I think what is happening now is that health workers are coming down because of shortage of PPE and because they need to be trained and retrained at intervals during this COVID pandemic outbreak.
Do you subscribe to the idea that there's also the problem of people who are asymptomatic or have other ailments going to private hospitals where the doctors there are not used, or the healthcare personnel there have not gone through this training?
Yes.
And they are the ones, as the health minister says, quite a number of those who are testing positive are from here.
Yes. Very, very important, because so many people, because of lack of trust in the public facilities, they go to private facilities to access services. And that is what is happening now. the health workers there are not really trained. The hospitals are not purposely built for infectious disease like COVID-19. So people are unnecessarily being exposed while carrying out their duties. And that is why we see more and more health workers from private facility coming there because they were not trained. They didn't prepare for it. And you know, another thing is that when people get there, they don't even disclose their traveling history or their status to these people. And because the hospitals are not purposely built for infectious disease, they are not wearing their PPE when they are examining and everything. But now I think the sensitization, the education, the information is going around. So we hope things will get better.
265 people returned this evening from Dubai, the UAE. Others are scheduled to return in a couple of days subsequently. Government has made arrangements for. Are you satisfied with those arrangements that have been made so that their own issues do not come into the issues we are already dealing with?
I think well, the government is trying, because what I heard is that there are hotels and there are isolation centers that they are going to be for 14 days. Then they will be, if any symptoms come up or something. So it's okay. They are not going to, like I heard this evening, that none of them is allowed to interact with any members of their family at the airports. So they are from the airport straight, the health workers, the people involved, they are on grant to take them straight to the isolation center, which is actually the best.
But then with the health workers themselves at those centers, going back to my previous question, because they don't know, I mean, many of these people may be asymptomatic,
yes.
as you
yes, but I am hoping that the health workers will be of high index suspicion. They will, of course, protect themselves, knowing fully well that any of them might be asymptomatic carrier, and so I'm sure they will take precautions so that they won't take the virus back to where they are working.
I must ask you this, especially because now everybody's talking about personal responsibility. We should take responsibility, yes, and all of that. And you alluded to it in your answer to the previous question, where you mentioned that you hope that we don't have to go back to a situation of relocking the country down, especially if we get a spike. How would you go about flattening that curve, even though people are moving around? How would you go about flattening that curve? The last time you were here, you talked about community spread and contact tracing. Yes. How is that going, and how is that impacting on this part of it?
Well, just like you said, it has gotten to the stage of each person taking responsibilities, organizations taking responsibilities, community leaders taking responsibilities, church leaders, market leaders, and like that, taking responsibility. Everybody needs to do their parts in flattening the curve. If, as the lockdown is being eased, if everybody takes to that precautions of when you are going out, put on your face mask. But what we are seeing now is that though people have the face mask, but it's under their chin. They're not wearing it properly. And you can, from yesterday and Monday, we can see the number of people at the banks, at the various banks. If we continue this way, it's not likely that we'll be able to flatten the curve, because the cases will continue, because we have so many asymptomatic carriers in the communities. You don't know who is sitting next to you. Look at the buses, the vehicles on the road now. Even though government has sensitized them, told them to carry maybe 60% of their usual, but they don't adhere.
And those that are adhering are telling those 60% to pay for the rest.
To pay for the rest. And how many people can pay for that? Everybody is just trying to. So, but if we continue like this, it's not likely we'll be able to flatten the curve, because the cases will continue to rise. So it borders on the fact that governments are doing their part. People need to do their part. Organizations need to do their part. The banks need to put something in place to be able to control the population. The markets need to put something in place to be able to control people. Supermarkets need to be able to do that. Everybody needs to take responsibility so that we'll be able to flatten the curve.
Dr. Oluwole, each time you speak, I'm just wondering whether the right people are listening, because what it brings to mind is the transporters who are asking for people to pay for the empty seats, which means that they don't quite see it.
Yes, because they don't understand. They don't understand. Some people still say COVID-19 as problem of the politician, the rich people, but it's not. COVID-19 doesn't know anybody, doesn't recognize anybody. Anybody can come down with it. But we just have to continue to educate, create awareness, let people understand. I think for the transport especially, they have union. I think their union leader needs to be called to attention so that they can take responsibility of their people. And I learned that when people get to the bus stop, they actually don't, everybody wants to be safe. But when you tell them to pay 500 naira instead of 100 naira, okay, I will manage, sure, let me get home. But before you get home,
anything,
you might have caught the virus. Who knows?
Thank you so much, Dr. Oluwole. Thank you so much for coming in. Dr. Oluwole is a consultant public health physician. Thank you for your time.
Thank you for having me.
Let's go outside our shores, where we haven't got the figures from South Africa for today, but the country recorded a 352 case jump in the number of confirmed cases, taking the total to 7,572 over the last 24 hours. The death toll went up from 148 from 138 the previous day. For some of the happenings in that country today, here's Betty Dibia reporting from Johannesburg.
Thank you, Ladi. I'll begin with news that broke this evening that an essential member of staff in South Africa's presidency has tested positive for COVID-19. A statement released by the spokesperson to the president, Ms. Kusela Diko, says that access to the seat of government, that's the union buildings in Pretoria, has now been restricted to only exceptional interactions. Meanwhile, the debates and court cases over the letter and the handling of certain aspects of lockdown regulations have continued. From racial to economic perspectives, and the statements or the stand of government has not been helped by some of the statements by Finance Minister Tito Mboweni breaking dance, saying that all businesses in the country, irrespective of the composition of the ownership structure, should be helped given the circumstances at the moment. Just like everyone else, President Cyril Ramaphosa has admitted that this situation is ruining the economy, and giving a figure to just some aspect of the ruin is the head of South Africa's Revenue Service, Edward Kleersvetter.
Whilst it is early days, our initial view is that the revenue performance will be lower than the February budget announcement by between 15 and 20%. What does this mean? It means that we could potentially face a revenue under recovery of up to 285 billion.
And the aviation sector is having problems just like every other sector. And it's not just South African Airways whose woes are about to come to a head. Latest to go under business rescue, voluntary business rescue now, is Comair, which is the operator of Kulula.com and a franchisee of British Airways in South Africa. While Fair Trade Independent Cigarette Association says it's going ahead with its legal challenge against the ban on the sale of cigarettes in the country, industry giant British America Tobacco South Africa has backed down on their own threat, saying that they're opting to speak more with government. Meanwhile, a Gauteng court today heard closing arguments in the brutality case brought against the South African National Defence Force by the family of the 40-year-old Collins Khoza, who was killed in Alexandra Township, Johannesburg, last month. Mr. Khoza died after allegedly being beaten by soldiers during an incident. Among everything else, the family wants those who were involved in that incident to be suspended. Judgment is expected in 2 weeks' time. Back to you, Ladi.
Thank you very much, Betty. The United Kingdom has become the first country in Europe to pass 30,000 coronavirus deaths. According to the latest government figures, 30,076 people have now died in the UK of COVID-19. Meanwhile, for the fourth consecutive day, the government has missed its 100,000 tests per day target, with 69,463 tests provided in the last 24 hours.
The rise in death toll in Britain has caused many to question the government on reasons why on Tuesday the UK overtook Italy to report 32,313 deaths, the highest official number outside of the US, with a population nearly 5 times greater. The Johns Hopkins University says that the number of cases in the United States has passed 1.2 million and that the death toll surpassed 70,600. President Donald Trump says that the White House task force will be winding down, with Vice President Mike Pence suggesting it could be disbanded within weeks. Health officials have warned that with daily deaths exceeding 1,000, the virus may spread as businesses begin to open. The death toll in Spain rose by 244 in the last 24 hours. The first time since Saturday, the number has risen above 200. There have been 25,857 confirmed deaths from the virus, and the country has confirmed 220,325 cases, a rise of 996 compared to Tuesday. Over in South America, Peru is reported to have more than 50,000 confirmed cases of coronavirus, the second highest number in the region after Brazil, which is far more populous. The death toll at 1,444 is also now the third highest in the continent after Brazil, which has 7,958 deaths, and Ecuador with 1,569. And in Africa, the Centers for Disease Control and Prevention, as well as research, say that more than 2/3 of people surveyed in 20 countries say that they will run out of food and water if they have to stay at home for 14 days. The centers warn that if measures are not adapted to local needs, there is a risk of unrest and violence.
We'll take a break at this point. When we come back, we'll be joined by our correspondent, Juliana Olainka from London. Please stay on with us. Welcome back. For the latest in the United Kingdom, we're being joined by Juliana Olainka in London. Good evening, Juliana, and trust that you're keeping safe at this point.
Good evening. I am keeping safe at home. Thank you, Laddie.
The figures out of the UK, and this is not for the first time, make for some grim reading. More than 30,000 people now are dead from this COVID-19 infections. What's the government there saying is really responsible for this?
Well, as you said, it's really a grim reading. It's a grim milestone. Britain today became the first European country to hit that 30,000 death milestone, and it's pretty sobering. Over the past couple of days, we've had, I would say, quite low recordings of deaths, but today it kind of rose again. We had 649 deaths. Today, Prime Minister Boris Johnson, for the first time in 6 weeks, was back in the dispatch box at the House of Commons opposite the Labour leader, Sir Keir Starmer, and he was pretty direct with this and said it is a really shocking figure. Not only is it being discussed up and down the breadth of the United Kingdom, it's also being discussed amongst our European neighbours and around the world as to why such a shocking high proportion of people have died. And of course, if you follow the figures that are being released from the Office of National Statistics, there are suggestions that it could be much higher, well above 40, perhaps even 50,000 deaths. Now, if you're a critic of the government, you would say that it was the lack of personal protective equipment. A couple of weeks ago, that was a major talking point here in Britain. There are some that suggest that there was just way too much focus on the NHS. Every Thursday night, we're out clapping for NHS workers, which we should do because, of course, they're putting themselves on the front line. But for weeks on end, Laddie, a lot of people working in care homes were being totally neglected. Well, that's what some would suggest. Which is why we've got this surge in deaths in care homes, not only amongst residents, but amongst workers. Also, as well, some would say that Britain were far too late in getting into the lockdown. We went into lockdown on March the 23rd. France, Spain, Italy, they went much earlier than us. Even Ireland, which is just a stone's throw away, they went into lockdown and closed schools when they only had about 2 or 3 deaths. So there are so many questions to answer. But the government have said, and they've said it quite vocally, that they don't want this comparative analysis. They believe that until the dust has settled and the pandemic seems to have retired and we have a vaccine, that's when they say that we can start comparing figures. They don't truly believe that the numbers that are being called by the rest of the world could actually be the true figure.
Indeed, Juliana, I want to say a very big thank you to you at this time. I was going to ask you very briefly to talk about the story that was breaking yesterday, just as we were talking. Is there any update on that?
There hasn't been any update on the cybersecurity. Yesterday it was the Foreign Secretary Dominic Raab that mentioned it. I believe, the fact that the Foreign Secretary said it so vocally does show that senior officials within the US and the UK will be working to try and combat this. But I would say before we go, another big talking point today is about the 200,000 tests a day. We haven't yet done 100,000 tests a day, but Boris Johnson today surprised everybody by saying he thinks he can get 200,000 by the end of the month. They're putting those targets there themselves, so they can't moan when people ask them to deliver.
Thank you very much, Juliana Olayinka, for that update from our studios in London, and do continue to stay safe out there. Thank you very much. The Minister of Foreign Affairs, that is the Nigerian Minister of Foreign Affairs, has been explaining the difficulties the government is facing with the evacuation of Nigerians abroad desiring to return home in the face of the COVID-19 pandemic. Speaking today, the minister explains that some Nigerians who are stranded in the Republic of China will have to pay 700,000 naira for the evacuation. That's despite the fact that some of the evacuees say they have return tickets with Ethiopia Airways.
These flights are chartered flights, essentially. The evacuation flights. They're not normal commercial flights. So obviously the Nigerians in China have tickets for a regular commercial flight. Now, if Ethiopian Airlines agreed to evacuate Nigerians and come back and bring them back to Nigeria, that would not be a normal Ethiopian commercial flight. And so understandably, they would not agree that a subsisting ticket for a commercial flight could be used on that charter, on the charter flight of Ethiopian Airlines. So
we're now being joined by Professor of Medicine, Division of Infectious Diseases Department at the Emory University School of Medicine in Atlanta, Georgia, in the United States, Professor Igor Ofotoku. Good evening, Prof, and thank you for your time.
Good evening. Thank you for having me.
In the United States, the problem or the balance seems to be between those who want the situation to rapidly go back to normal and those who are saying that we need to be cautious with this. In your view, who do you think is right and who's winning the argument?
Well, in this case, there is no right or wrong. I think we all should be on the same page. We know that there is definitely no treatment for or cure for this virus yet. The only way we know to control the spread of this epidemic is by public health measures that we have espoused. And we also balance that against the fatigue and the challenge of being locked down at home, depriving people of livelihood. So it's a very, very delicate balance. But I think at this point, sustaining life, keeping this epidemic under control probably should be the priority, and I think is the priority of majority of people here in the United States.
We have the same similar situation in Nigeria where there is this easing of the lockdown, but it's coming just as our case load is rising. So it's again a situation of balance. How do you think we're doing with that?
Again, like I said earlier on, there is only one approach to controlling this epidemic at this point. We don't really have any other effective measure. So the only effective measure is the public health measure. We have to do everything within our power to reduce the transmission of this infection. And we know it's transmitted by one-on-one contact with other infected individuals. And even more importantly is that there are people who have COVID who don't have symptoms. So you have a symptomatic carrier who can transmit this infection to others who are not infected. So we really need to strongly emphasize these public health measures that we know is working. We've seen example in China, we've seen the turnaround in Italy, and in major cities in the US like New York, where the epidemic about 2-3 weeks ago was taking hundreds and hundreds of lives. With the public health measure, we're seeing a significant steady reduction in the number of cases and the number of deaths. Until we have a vaccine or an effective treatment, the most important approach currently for any country, particularly in Nigeria where you have large cities like Lagos and Kano, we need to strongly enforce social distancing and public health measures.
Dr. Ofotoko, Professor of Medicine at Emory University in the United States, thank you for your time. We will get back to you later on for more detailed analysis. But for now, thank you so much for your time at this hour.
Thank you.
And that's how we're going to wrap up our COVID-19 update tonight. Thanks for being with us. We're back tomorrow at noon and at 6, and then, of course, at 9. My name is Ladi Akere Doluale. Good night.